Well, how do you like Sulphur Springs so far, Dr. Pandey?
Well, I really like it. I had a chance to visit here twice back in November and December of last year, and really got to see the community. Got to really see the people, the interactions between the people and the hospital system, and I can tell that it'd be a great place to practice, a place where I could have a real impact, especially considering that there hasn't been a neurologist here for the last three or so years. Yeah. So I feel like well, neurology is obviously a specialty that's near and dear to my heart, and I feel like everyone should at least have access to seeing a neurologist. And I feel that now that I am here and we are opening up this clinic, the people here won't have to travel hours away to be able to see their neurologist. They can have someone local who will care for them and make sure that they're receiving the proper care that they need.
Were you trained and everything? Did you do your education here in the United States?
I did my education here in the U.S. I did medical school up in Chicago, the University of Illinois, and then I went for training at Miami, Florida, and the University of Miami. Yeah. So I've kind of been all over, but Texas has been a place that's been near and dear to my heart. My wife has some family down here, and that's part of what drove us over here. But when I graduated med school, I always had this vision to go to an area where they didn't have medical care readily available, because I feel that it's really the best use of a medical degree to provide care where there isn't care. It didn't make sense to me to stay in a big city and just join a long list of doctors to treat patients that can see another doctor just as easily. So I feel like this is the best fit for me, and I really enjoy being here.
You talked about how neurology was near and dear to your heart. Tell us a little bit about that and what kind of cases and patients you will see here.
Yeah, so neurology, broadly speaking, is the science of the brain, the spinal cord, and peripheral nerves, so the entire nervous system. So a lot of people, when they think of neurology, they think of maybe headaches, or they think of strokes, or they think about memory loss. And to be honest, neurology is all of those. It encompasses a very broad spectrum of diseases. My specialty is in stroke neurology, and that's maybe something I'm a little more passionate about within the neurology spectrum. But I'm capable of treating any neurological conditions. I think about 20% of the population over 18 has migraine headaches, and that's something that can be very debilitating. Stroke is the #1 cause of disability in the U.S., so yes, obviously very disabling, as you can tell. And the key with stroke is you need to really have preventative measures in place before the stroke happens. Otherwise, once the stroke happens, it's almost a little too late, because then you're thinking of rehab at that point. So I feel like I can really come in and treat a broad range of conditions, as well as have an impact in things like stroke prevention and memory loss. There's some preventative things we can do for people with, I guess, mild cognitive impairment, we call it, kind of the early steps of dementia. So, and as well as seizures, Parkinson's, multiple sclerosis, neuromuscular diseases. So as you can see, the list goes on what a neurologist does. So I think it's very important that we have one in this community.
Seems like Alzheimer's disease has, gotten. We hear more about it all the time, and it may be something. I'm sure it's been going on for years, but we're learning so much about that. Seems like
exactly. And probably the awareness of Alzheimer's has gone up, and I think that's important because it lets family members know the early signs of Alzheimer's in their loved ones. And there are, like I said, some things we can do to kind of stave off the progression of Alzheimer's. The treatment of Alzheimer's is a little bit trickier, but there has been extensive research in that area. So I do think that would be something that I can provide for the community, because memory loss is it happens with age, but there's specific signs that are apparent in people with progressing dementia. And to really differentiate between the two, you need a professional to come in and be able to pinpoint the differences. So I think that's a good point, that Alzheimer's has been more I guess the community has been more aware of Alzheimer's, but still it's still not to the point where you can diagnose Alzheimer's without a professional opinion.
I would assume that you will get most of your patients as referrals from physicians, I would think.
Yeah, exactly. I'm starting to kind of develop the connections with the other doctors around here to make sure that they know I'm in town. I'm sure the people that you reach with your network will also hopefully be hearing this and also be aware that the neurologist is now in town for them, for their needs. So I think it should be a combination of physician referrals, but as well as hopefully community referrals if someone comes to the clinic, enjoys the care that they receive, and refers my name to someone else in the community. I think that would be just as good.
And so when did you begin, actually? What was your first day?
Well, no, I haven't actually started yet. So the first clinic, we're opening the doors tomorrow.
Oh,
so
okay.
they do have other specialties in this office building, but neurology itself will start tomorrow in the afternoon. So we have spots available for the following week. So pretty quick appointments are available.
Will you be available on a regular basis in this location on a weekly basis?
I will, yeah. So right now, we're just because my name hasn't been out there as long, we only have 3 half days of clinic, but we definitely have the rooms for it, and we see the clinic progressing to the point where maybe even 5 full days of clinic a week. That would be the expectation, I think.
Well, you mentioned that you were looking, your dream was to move to an area, and obviously it's been hard for us to find a neurologist here. It was, you mentioned how long we had gone, and I think at one time the board may have just about given up, but always wanted to continue to look, and so I know your answer to prayers for a lot.
Yeah, that's what everyone keeps telling me, that I'm kind of the neurology savior for the community, but it's something that everyone has a right to be able to go to someone trained for their symptoms. I know a lot of the primary doctors here have been trying to treat headache and trying to do things for stroke prevention and other maybe seizure management, things like that. But I feel like it really is obviously best served for someone who's went to school and went to training with that focus in mind to be treating those conditions. So that's what I'm here for.